I'm pleased to be joined today on Health Beat by Dr. Michael Woodbury, an orthopedic surgeon with Faith Regional Physician Services Orthopedics in Norfolk, and we're talking about joint replacement. So Dr. Woodbury, what are some questions that you should discuss with your doctor when you're considering having a joint replacement?
Anybody considering having a joint replacement first needs to talk to their doctor about what are the risks of the surgery, how long will the surgery take, what's the recovery period. So generally speaking, the risks, if maximized all of your medical issues, people who have minimal medical problems or that are managed very well by their regular doctor, do very well with surgery. There are always risks with surgery, one of which would be pain continuing after the surgery. Blood loss can be an issue if you're dealing with the hip. A lot of times with knee, there's a tourniquet used, so you limit blood loss. The other kind of risks are the nerves and everything that are around the joints. Those can be at risk during surgery. It happens very rarely, but they can cause complications later. The other thing that patients always want to talk about is how long will the surgery take, or how long will they be in the hospital. Being in the hospital usually is 1 or 2 nights stay in the hospital for a hip or a knee replacement. The surgery for either one generally takes about an hour to an hour and a half. At Faith Regional, we get you up walking right away and try to get early mobilization. It helps with recovery. Usually on pain medication for about 6 weeks, which is multiple different types of medication, not just a narcotic pain medication. And most people, depending on which leg it is, always wants to know when can they drive. So if it's the right leg, generally about 6 weeks after surgery. If it's a left leg, it can be up to 2 weeks after surgery or even longer, depending on how they're recovering from it. And of course, if they're driving, they can't have any narcotics when they're driving. So that's another thing I discuss with them in the office. And it's also something that someone should talk to their surgeon about, is how long will they be on that pain medication.
But no question is off base, right?
No questions off base. They're generally, I enjoy multiple questions. It helps them understand their procedure, and it helps them understand their recovery.
Sure.
So the more questions, the better.
All right. Thank you so much for being here today.
You're welcome.
Okay. That's Health Beat, brought to you by Faith Regional Physician Services.